Hello, and welcome to Sensory Integration Theory and Practice. Dr. Jean Ayres describes sensory integration as the organization of sensation for use. It can also be defined as the neurological process that organizes sensations from one's body and from the environment and makes it possible to use the body effectively in the environment. Another definition is sensory integration is information processing. The brain must select, enhance, inhibit, compare, and associate the sensory information in a flexible, constantly changing pattern. In other words, integrate it. So, sensory integration is essential because we need it for all activities of daily living. Sensations need to be perceived, organized, and interpreted to support overall function. So, sensory integration impacts occupational choices and our occupational roles and responsibilities. We need it for arousal, alertness, attention, cognitive abilities, motor skills, praxis, emotional regulation, social communication, interaction, and the organization of time and space. We can break sensory integration down into two areas. We have sensory perception and discrimination. This refers to our ability to detect and assign meaning to different sensory stimuli. So we can detect and distinguish between things through its color, texture, size, and shape. Sensory perception and discrimination involves discriminating between sensory input and categorizing it. We also have sensory reactivity and modulation. This involves our ability to regulate our arousal state and our adaptive responses to the sensory input. This involves how our body reacts to the input provided and whether it is an appropriate level of responsivity to the input provided. So we can think of sensory reactivity and modulation as volume controls. So thinking about adjusting our reactivity, and sometimes it may be too high or too low. More definitions: bilateral integration and sequencing. This is our ability to coordinate both sides of the body to perform a series of sequenced and synchronized movements. Bilateral integration and sequencing requires both sensory and motor skills using lateralization of two sides of the brain. Body scheme. The integration of somatosensory input gives us an unconscious map of our physical body, which is then stored in the brain to be used for daily tasks. Typically, developing individuals should be able to do this unconsciously and without effort. We also have postural ocular control. This involves motor control of both the body position and eye movements. This supports the body in being able to stay stable when moving, with movement involving both the head and the eyes. Praxis. This is the ability to organize a series of novel actions. It involves using motor actions we already know how to do and sequencing them in a manner so we can engage and execute motor tasks. So, our sensations. We can break this down into three areas, being interoception, proprioception, and exteroception. Interoception refers to our internal sensations, and it involves things like our hunger, thirst, and our bowel and bladder function. We also have proprioception, which is processed in the muscles and joints, and it provides us with information about our body position and movement. Exteroception is the processing of sensation from outside of our body, which includes hearing, vision, smell, touch, and taste. So, when we think about sensory integration, it's important to consider receptor capability. So, for each sensation, in order for that information to be processed, those receptors need to be capable of receiving the information. So, for example, someone with a hearing impairment, they have poor receptor capability. So this doesn't necessarily means that they have a poor ability in their brain to process that sensory information. It's relating more to their receptors having difficulty detecting the information. We can also think about transmission capability. So if receptor is received, then it has been converted from the sensory stimulus to allow the sensory system to read and interpret it. The conduction of that process is referred to as transmission capability. When thinking about sensory integration, we can think about neuroplasticity. So, this refers to the brain's capacity to change via neural changes, which increase connections and thus develop skills. So, brain derived neurotrophic factor is essentially the neuroplasticity juice that supports neuroplastic changes. It involves oxytocin, which we receive through love and relationship, dopamine, received through reward, and adrenaline, received through fun. So we need all three of these for the brain to have effective changes. And it's also important that the children experiences this internally rather than from a cheerleader effect. What is needed in therapy? Adaptive responses are when successful response to an environmental challenge. So this means this is when the child is an active participant, there are appropriate supports in the environment, and then the adaptive responses can then create change in the brain. So children have an inner drive for the just right challenge. This means that they seek out challenges that are not too easy, that it's boring, but not too hard, that it is difficult for them and they feel like they're a failure. It's really important that children engage in the just right challenge so they're able to make progress and success in their therapy. Sensory reactivity. A child's adaptive responses are reliant on their capacity to be reactive to stimuli. So this can be multiple factors, including pleasure or aversion, arousal and alertness, affect and emotion, attention, activity, hyper and hyper responsiveness. So thinking about increased or like over or under responsiveness, and any fluctuating responses. Sensory discrimination and perception. So, this is often observed through skills that we see in everyday life. Strong perceptual skills means you are receiving active information that allows you to react appropriately to everyday stimuli. This is often seen through touch, vestibular input, and proprioception. We can break this down further and look at tactile perception and emotional and social development. So, thinking about rooting, sucking, and grasping in early childhood and how this relates to children forming attachments with their caregivers and then attachments and relationships later on in life. We can look at motor control, which includes body scheme, oral motor skills, and then knowing where our body is relative to people and objects. We can also look at our vestibular perception, which includes gravity awareness, postural control, holding still and upright, maintaining balance while moving, our head, neck, and eye control, and coordinating head movements with trunk and limb movements. So, thinking about using both sides of the body. So, now we can look at childhood development of sensory integration. So, sensory integration is crucial during the early months and years of life as this sets up the child's nervous system for success. Early attachment is the foundational building block for early tolerance of touch and smell. Sensory integration starts to develop as early as when a mother is pregnant, and it continues to develop up to the age of 7 years. So, particularly in toddlerhood, this is when the vestibular and somatosensory systems are developing. And then from the ages 3 to 7 years is when children have increased praxis and motor planning. And then from 7 years onwards is where children have increased ability to self regulate, use cognition, and increased skills in their motor skills and social skills. After the age of 7, we can make changes to how a child integrates sensory information. However, we know that from pregnancy to the age of 7 years is where it's being developed the most, and early intervention is really important for supporting progress. Here is an analysis of sensory integrative functions. So as you can see under visual praxis, this is our visual motor skills. We also have vestibular bilateral integration, which refers to our postural control, bilateral coordination, and sequencing abilities. For proprioception and tactile somatodyspraxia, this includes our gross motor skills, praxis, fine motor skills, and auditory language and organization of behavior. On the right, we through reactivity or modulation, and this refers to our alertness level and regulation. Sensory processing disorder. So, this is a neurological condition where the brain has trouble receiving and responding to information that comes through the senses. People with sensory processing disorder may be overly sensitive to stimuli, which we can refer to as hypersensitivity, or under-responsive, hyposensitivity. This can affect how they perceive and interact with their environment. So, under sensory processing disorder, we have sensory modulation disorder, which is the ability to modulate our sensations and react to it. So that's where we might see the responsivity or under responsivity. We also have sensory-based motor disorder, which is challenges with posture and praxis, and sensory discrimination disorder, which is challenges discriminating different sensations. When thinking about sensory integration, we can use a data-driven decision-making model. So in this model, the first step is to identify the child's strengths and participation challenges, conduct a comprehensive assessment, generate a hypothesis from the assessment data, and then develop and scale goals and identify outcome measures. We can then set the stage for intervention and conduct the intervention, and then measure outcomes and monitor progress. Sensory perception. So a part of sensory perception is the tactile system and development of touch. Touch begins to form at 7 weeks gestation, and it is our earliest form of communication, which is critical for attachment. This also reflects the importance of therapeutic use of touch, which is commonly seen in NICU. The important considerations for touch include having a reasonable amount of nurturing touch, as this forms attachment. We can also look at baby massage, which has become a well-known approach where classes are now being offered in local public hospitals to expecting mothers. Touch forms our ability to explore ourselves and assist in establishing perceptual maps of the body. And in early development, it is typical for children to explore objects through touch, and this forms their understanding of the world around them. It's also really important for children to explore objects with touch so that they are then able to use the objects and play with them. We can also look at nurturing touch, so things like baby wearing and carrying, kangaroo care, and skin-to-skin contact. The proprioceptive system. Proprioception plays a crucial role in our movement and the development of body awareness. It involves sensory inputs from touch and vision that help children form a sense of self and guide their physical actions. Key aspects of proprioception include that is, it is essential for developing motor skills and praxis, and it is vital for somatosensory processing, which helps us understand our body's position in relation to gravity. So the proprioceptive receptors are found in our muscles, tendons, and joints and provide information about the body's position and movement. The type of nerve endings activated determine where and whether we perceive the movement. So signs of poor proprioceptive awareness may include behaviors such as tapping, chewing, frequently touching objects, and possibly frequently falling over objects and not being aware of the space around them. The vestibular system. The vestibular system provides crucial information about our position in relation to movement and gravity, making it one of the most important sensory systems. The vestibular system is located in the inner ear, and there are two main types of receptors. The first receptor detects linear movement and gravity, and the second detects rotary movements. So the vestibular system reaches full size by about 16 weeks of gestation, and the fetus processes both its own movements and the movements of the mother. The vestibular system prepares for birth by adopting an inverted position, spending the last month in this orientation. So, the type of vestibular processing or vestibular integration deficits that we can see include gravitational insecurity, over or under responsiveness to movement, and, and vestibular, ocular, and postural control issues. Thanks for listening.